Alprazolam belongs to a group of medications called benzodiazepines. It is available as a tablet, and it is well known by its brand name, XANAX. However, nowadays a number of generic versions are available. Alprazolam can increase the actions of a mediator called GABA in your brain. This produces an inhibition on neuronal activity and helps in reducing anxiety. Therefore, alprazolam is used in the treatment of generalized anxiety disorder. It can also be used in the treatment of panic anxiety disorder. It is another condition where anxiety is associated with few symptoms like palpitations, tremors, and shakiness. Alprazolam can reduce anxiety and relieve these symptoms. In this video, we will explore key facts about alprazolam, like how it works in reducing anxiety and seizures, what its effect is on attention, what the common side effects are, how to take this medication, and what the important precautions are. Now let's see how this medication works. Alprazolam works by calming a few neurons in the brain. Neurons play a key role in the transmission of signals from higher centers of the brain to the various organs of your body. This communication is facilitated by a few of the chemicals called neurotransmitters. Glutamate is an excitatory neurotransmitter that stimulates the target organs where it supplies. It can activate a few centers in your brain that increase wakefulness and reduce sleep. They can also increase anxiety. In a few people, these neurons are excessively activated, which may result in the induction of seizures, panic attacks, insomnia, or anxiety. However, the action of glutamate can be controlled by another mediator called GABA, gamma-aminobutyric acid. It is an inhibitory neurotransmitter that acts through GABA receptors. Alprazolam works by facilitating the action of GABA on its receptor. It binds to a specific site on GABA-A receptors that promote binding of GABA to its binding site. This opens chloride channels, which enter the target cell, leading to a negative potential within the cell. This results in inhibition of the target cell and prevents its excitation. This can control stimulation of neurons and reduce symptoms of anxiety. How to take this medication? You can get alprazolam as normal tablets as well as extended-release tablets. Normal tablets are also called immediate-release tablets, and they are available in different strengths starting from 0.25 milligrams to 2 milligrams. Extended-release tablets release the medication slowly, and they are available in strengths starting from 0.5 milligrams to 3 milligrams. You can also get alprazolam as orally disintegrating tablets. They are also called dispersible tablets that can be used in people with difficulty swallowing. However, these tablets should be handled properly, and they shouldn't be taken with wet hands. Once opened, they should be swallowed with a glass of water. This medication should always be started at the lowest dose possible to eliminate significant side effects. The right dose of this medication depends on various factors like age, patient conditions, and purpose of use. It can be given either as a single dose recommended to be taken at bedtime or as multiple doses. For treating panic disorder, alprazolam may be given to you initially at a dose of 0.5 milligrams given twice daily. After 3 to 4 days, the dose may be increased at a rate of 1 milligram per day. For treating anxiety, it may be given at a dose range of 0.25 milligrams to 0.5 milligrams, and it can be given 3 to 4 times per day, based on a requirement. However, the dose should not be increased by 4 milligrams per day. Never stop this medication suddenly, especially when you are using alprazolam at higher doses. It may cause withdrawal effects if you suddenly stop. It is more important when you have used this medication for longer than 4 weeks. Your doctor may reduce the dose of alprazolam slowly over a few days in such cases. What are the side effects? One of the common side effects of alprazolam is sleepiness. This can make you feel sedated and drowsy. You may also have dizziness. It can produce dry mouth and constipation. Alprazolam can produce motor impairment that can cause trouble in movements. This side effect is more pronounced in elders, and it may result in loss of balance. You can also have a few illogical dreams occasionally. Particularly in the elderly, alprazolam can cause memory impairment. They can have a state of confusion along with sedative effects. However, this affects loss of short-term memory, forgetting things, and current events. At doses higher than 4 milligrams, you may have confusion, blurred vision, tachycardia, and nasal congestion. Now let's see the precautions of alprazolam. Alprazolam may impair your attention, and it may cause daytime sedation. Since this drug stimulates a few inhibitory neurons in your brain, it can cause central depression. Especially, sedative effects are more observed in the early days of therapy. That's why it always started at a low dose, as your body needs an adjustment to this medication. Therefore, be cautious while driving or handling heavy operations until you feel normal and alert. These daytime sedative effects may slowly disappear with continuous use. However, a few other conditions can exaggerate these sedative effects. If you're taking any other medications like antihistamines that are used to treat colds and allergies, the sedative effect may be more enhanced. Taking alcohol can have serious effects on sedation and drowsiness. Therefore, avoid the intake of alcohol while using alprazolam. Few other medications may interact with alprazolam. Strong inhibitors of CYP3A4, like azole antifungal agents, should be avoided with alprazolam. They inhibit the metabolism of alprazolam, leading to its elevated levels in the body. This may cause significant sedation and drowsiness. Therefore, medications like ketoconazole and itraconazole are contraindicated with alprazolam. Few medications like ritonavir may also increase plasma alprazolam concentrations. Therefore, dosage adjustment is necessary when taken with ritonavir. Alprazolam can increase salivation, so if you find any excessive salivation, you should talk with your doctor. At very high doses, alprazolam can cause depression of your lungs. Therefore, avoid alprazolam if you have severe difficulty breathing and shortness of breath. In the later stages of pregnancy, use of alprazolam can bring depressive effects in newborns. Infants may have drowsiness and difficulty feeding. It is also secreted into the milk. Therefore, alprazolam should be carefully used in pregnant and breastfeeding women. Alprazolam can increase depressive symptoms. It may cause hypomania and mania. Therefore, it should be carefully used in people with pre-existing depression. Do not increase the dose even if you think the medication does not work anymore without consulting your physician. For patients treated more frequently than recommended, use a gradual taper to discontinue therapy. A patient-specific plan should be used to taper the dose to reduce the risk of withdrawal reactions. Suddenly stopping intake of alprazolam can reverse its effects. Normally, this medication induces sedation and sleep and reduces anxiety. It also reduces the incidence of seizures. If you suddenly stop, these effects are reversed, leading to withdrawal effects. On sudden withdrawal of alprazolam, you may have increased anxiety and irritability. You may have difficulty sleeping, tiredness, sweating, and seizures. Therefore, never stop it suddenly. And in case you want to stop this medication, gradually reduce its dose over a few days. Opioids are the steroidal medications that are used to control pain. They work by inhibiting a few neurons in the brain that elicit pain signaling. These medications can have a depressive effect on neurons, and they induce sedation. Therefore, never combine opioids with alprazolam. This can severely impair your attention and cause severe drowsiness. It can also lead to the induction of coma and even death. These are the important things about alprazolam. That's all, guys. Thanks for watching this video. Have a great day.